Now, many people lost their jobs during COVID because they refused to take the vaccine. Now, as we look back and question the decisions forced upon us during that time, the New South Wales Police Force is officially welcoming back unvaccinated cops. Ben Falconer broke the news on 2GB.
Posts will go up on Facebook and LinkedIn inviting former cops to rejoin the force. About 50 officers who did not get the vaccine were sacked for not being jabbed. They were let go by the previous commissioner because they didn't comply with her orders. And we've spoken to a number of them, including Justin Poor. He was axed for severe misconduct for failing to follow the directions of Karen Webb.
Well, to unpack this development, I'm joined by Ben Falconer, a WA police officer who was sacked during the pandemic, and John Larter, a former paramedic who was been one of the driving forces behind this reversal. Welcome to McKnight Tonight. Ben, I did say I'd end up getting your name wrong when we were talking before the show. Sorry about that. John, what's the relevance of the reinstatement of these officers? Why now? What's it saying? What's behind it?
Well, I think it's a telling time, Rob, because we've been fighting this for 6 years. There are still numerous other industries. There's still police around the country. There's still paramedics, nurses, people working in jails from all sorts of walks of life that are still unable to return to work. So I think this is a small step forward. It indicates that on this occasion, at least, the New South Wales Police Commissioner was willing to look at things from a sensible, common sense point of view and make a rational decision at the end of the day.
Now, the response about COVID is something you talk about a lot on Club Grubbery and the Bullseye podcast, which, just to declare, I do produce that show because you use the video podcast services that I do. COVID has been a big discussion point for you guys, but it wasn't just police and paramedics who lost their jobs. People in television, people I knew in television and radio lost their jobs, all because they wouldn't have the COVID vaccine. It just doesn't seem fair to me especially when I look back in hindsight.
Yeah, none of it made any sense, Rob. I mean, this was never based around science. As a 25-year paramedic, I wasn't seeing anything out of the ordinary that I wasn't seeing in a normal flu season. So it was a complete overreaction. And what we've seen is so many difficult situations occur as a result of it. People not being able to visit loved ones in nursing homes when they were dying, people suffering mental health, young people suiciding, people not keeping up to date with their medical checks, people losing faith in the medical system and with their doctors. The list goes on. People were sacked. They had no income. We've got veterans that are living, on the street, nurses that are living in cars, a cost of living crisis. I mean, the whole thing's a complete and utter mess. But there doesn't seem to be any willingness to reverse what was a very bad decision. And I think the Fauci stuff last night is indicative of just how bad they got it. And these dopes in the TGA and the government followed all this advice. They didn't question any of it. And they just went about, this control, just essentially, making money for pharmaceutical companies. That's what it's amounted to. And, we're in a big mess because of it.
It's interesting. That's a very big story. Ben, you lost your job because you wouldn't get vaccinated as ordered by the WA Police Commissioner. So why did you decide not to comply?
I was labelled by the media as a anti-vaxxer, but at no point, prior to COVID did I have a strong opinion on vaccines. I was deeply concerned about the infringement on liberties. I watched the story unfold and I could see the narrative changing, and I was looking at the data myself, the government's own data about COVID, and I could see that it wasn't the threat that it was initially thought to be. And then I watched the narrative shift where they started to track cases, and I observed deceit. and then I observed the lockdowns and restrictions on, movements. And in Western Australia, and the same is true for the rest of the country, they essentially arrested everybody who was in Western Australia. The cell was very large; it was the whole state, but you couldn't leave. And as a police officer, I, was in the business of taking people's liberties away. And when I would normally do that through process of arrest, the conditions would have to be very precise. Yet all of a sudden, due to a virus very similar to the flu, suddenly the entire state was actually placed under arrest. And I thought that was disgusting. And I was actually very hostile to it. And I just couldn't participate in it. And I couldn't participate in that system.
But that's interesting, because it's one thing to feel hostile to it, but to put your job on the line, or did you not think you were putting your job on the line when you refused to take the vaccine? Because, to be honest, all of Australia, except those who stood up and fought, and I wasn't one of them, I took the vax because of work and just to be able to go anywhere. I made that decision, but I look back thinking, how dare the government force me to take something? Educate me, sure, put your case forward. But you literally stood up and said, well, you lost your job because of it. Did you think you would lose your job?
I took the unusual step of suing the Commissioner of Police and state government, or the Chief Health Officer at the time, challenging the mandates. At the time, this is back in sort of early 2022, 70% of the WA workforce was under mandates, compelled to get vaccinated or risk losing your job. That was disgusting. And I ran public litigation. We had a judicial review. I was in the WA Supreme Court for 2.5 years, and subsequently, the Court of Appeal as well, doing my utmost to try to challenge and overturn and hopefully produce some case law to, try to return some liberties and test to see if how the government was behaving was actually correct. Unfortunately, we learned a lesson that was foreseeable. We didn't, I knew the risks were real. After all, I was fighting the government in their own house, namely the Supreme Court.
Which you took it all the way to the WA Supreme Court, but you lost that appeal, didn't you? So
yeah,
that's a lot of money to do anything in court. You've tried to, put your case forward. Do you have any regrets?
Not at all. It was the right thing to do. The government was behaving terribly, and the laws that they relied on to pass the mandates are still in place today, and they could do it again. The courts sided with them and allowed them, basically they could do the same behaviour again today, and it would be likely upheld by the court and defended by the court. It's the risk of having bad legislation, and it's the risk, in a lot of Australia, in all the different states, we've got similar laws. WA has a law where, under certain conditions, an emergency health circumstance, police can be authorised to use force to hold someone down, strip a person down to their underwear, and actually have a doctor forcefully vaccinate them. And that's in past legislation, in the ironically named Public Health Act, because I suspect that has nothing to do with public or health.
Wow. I've got to be honest, I didn't know that. John, you also lost your job as a paramedic because you chose not to comply with the mandate. Would you take the same stance now, knowing the consequences, because you have had a big financial impact? It's hard to get work even today. Would you do it again?
Yeah, 100%, Rob, because it was never about, keeping the job. It was about, my focus has always been on safety and looking after people. And I think if you can't, look people in the eye and say that you're raising awareness, or you're putting your hand up to say that something's not right in the workplace, or you're noticing something that's not right that could affect the safety and well-being of people, well, you're not acting in good faith. You're not acting as a good human being. So we went about that that legal pathway, and no, it didn't win. But look, it's a line in the sand. I mean, we've got that there forever, so we can go back in 5 years' time and say, well, you know, they were the arguments that were put in those cases, and in Ben's and in the Kassam case that Tony Nikolic brought. They were a flag on the hill, and the public will be able to see, you know, in 5-10 years' time, that they were very well put arguments that should have succeeded, but there wasn't a willingness at the time to reverse any of this. You know, even the courts were mandating vaccines. So I mean, what hope did you have?
Do you feel like there's been a change, John? Because I feel like we're asking more questions about that time. The way I see it is COVID, everyone wanted to feel like they were in World War II, having to do their bit, keep calm and carry on. Then everyone got over it. Then they didn't want to talk about COVID again. They wanted to move on. But I feel like now enough time's passed that we're looking back and going, not sure about that. You know, we have Carl Stefanovic apologising, Dr. Nick Coatsworth apologising for the things they said, the advice they gave. Do you feel that we are at a point where we're ready to reflect about the decisions that were made?
Well, I personally don't think we'll be able to get through this until we have a Nuremberg 2.0 style of inquiry. That's how serious it is. I mean, I think this is probably the worst act in human history. This is worse than the Germans in World War II, and I don't say that lightly. Millions of people have died from these vaccines, and millions have been injured from them, and we can't walk away from that. We can't walk away from these people. This is absolute tragedy. I mean, these people like Fauci last night and what went on. I mean, to get the use of these vaccines, Rob, they had to get an emergency authorisation. And the only way that they could get that legally was to say that there was no other drug or medicine that was effective to combat COVID. Now, that was nonsense, because they had ivermectin, and they had hydroxychloroquine, and they had other things like vitamin D, vitamin C. Now, we've had numerous experts worldwide that are absolute champions in their field of medicine that have said those avenues were available and should have been used, and there was absolutely no use for this vaccine that was experimental. And they knew, I mean, the side effects that were listed in the Pfizer papers were outrageous. It's no wonder they were trying to have that ban from being released for 75 years. I mean, so that tells you everything.
Explain something to me, John, because I've got a graphic here. Because was the COVID vaccine untested? I always thought, geez, it came out bloody quick. How did they get it up? But, you know, there are claims, it was on Reuters here, saying that there was rigorous testing in multi-phase clinical trials involving tens of thousands of human volunteers before public distribution. So how does that work? What do you make of that?
Well, I make of that Pfizer knew in their particular instance that these products were going to cause issues, and they knew of that. I mean, why would you essentially have a situation where they were trying to have this stuff put away in the vault for 75 years? Why is it that no government worldwide will tell you what the contracts were in relation to these vaccines? Why are they indemnified? I mean, if the products are safe and they're effective,
so
why
sorry,
do you need...
Explain that 75 years thing. Are you saying Pfizer wants the vaccine in a vault for 75 years so that it can't be tested for the full side effects it's had on people?
They knew what the side effects were, but they tried to have the information on these vaccines suppressed for 75 years. And a Supreme Court in the US lifted that and ordered them to release the data on it. That's why we got hold of it. And people like Naomi Wolf were then able to actually go through what was available and decipher what was in there. And what they found was absolutely outrageous. I mean, even some of our own doctors here, Jayanthi Kunasaran, she was involved, a very highly trained doctor here in Australia. So it was just very, very, very poorly done. I mean, whether it was corruption, you know, That's why we need.
See, that's where I'm going to disagree with you. Well, I like to think that everyone was trying to do their best during COVID. Maybe they got caught up. There are some interesting things coming out about Fauci, about what he privately thought and what he publicly said. But it's a real concern if people were corrupt during COVID and doing the wrong thing purposely by the people, isn't it?
Well, it's an outrage, but I think that's why we owe it to the world to have a thorough examination of the facts in relation to this. And only a Nuremberg II style world inquiry will get to the bottom of it. I mean, because we don't know. And that's the thing here, Rob. I mean, I'm not saying categorically that everyone involved was corrupt, but certainly things don't smell right. I mean, you only had to see what went on last night in that hearing to say, well, hang on, there's something not right here. Why is the government in Australia redacting? You put in an FOI and you get back 75 pages of black ink from the Australian government. Why in New Zealand?
That's crazy. I want to clear something up for our viewers, which I'm sure is something they're thinking of regarding both of you. Are you, John and Ben, are you anti-vaxxers? Ben, you first.
No, not. Well, at least I wasn't prior to COVID. Prior to COVID, I'd had all of my childhood and adult vaccinations. I've become somewhat more concerned about the whole pharmaceutical industry since then. But I'm not, prior to COVID, I wasn't, it wasn't my position at the beginning or during the litigation. I'm pro-choice in relation to vaccination. If somebody wants to get the jab, more power to them. May they have the liberty to do it, as the liberty for someone who chooses not to. If it's effective, then the person who's chosen to have that vaccination can benefit from it. And those that choose not to get vaccination, that's entirely up to them as well. Like, where was the liberty? Where were the freedoms?
I think the lack of choice is a concern. John, what about you?
Well, we've got 6 kids, Rob. Every one of them's vaccinated for every childhood thing. I took everything. The only one that concerned me at the time was the mRNA vaccine that came out. But I've got to say that since that and the bad taste that left in my mouth, I've done a lot of research since, and I've got to say that I am anti-vaccine now because they're not tested.
So this has put you against all of them because of what's happened with COVID.
Well, none of the childhood vaccines, Rob, have been double-blind placebo tested, and this is a real issue. I mean, if we look at, say, for instance, measles, the measles figures.
Yeah, but measles is on the rise now that they've stopped. Under RFK, isn't measles on the rise since they've been reduced the vaccination?
But this is the reality, Rob. I mean, we have to look at the risk-benefit analysis, and we spoke about this with Dr. Philip Altman this evening on Bullseye. Now, I mean, he's a guy that's been in the pharmaceutical industry for 40 years. He was the same as me, believed in the vaccines, but now he doesn't, because at the end of the day, we've been lied to. The statistics on these childhood vaccines indicates that they were never tested properly, and in fact, when you look at the data, the fatality rates and the occurrence rates were next to zero before the vaccines were even introduced. So you've got to ask yourself why we've gone from half a dozen vaccines to in some cases 80. Well, I mean, why is that? And then you've got all these rises in autism, you've got all these rises in food allergies, you've got all these rises in autoimmune diseases, cancers. I mean, the elephant in the room here is clearly needing to be looked at, and I think we just have to pause and just say, well, we need to review it for safety's sake. I'm not saying They are, but I'm saying we need to stop and just have a look at where things are at, because
I
do we
don't
just
think
keep...
there's anything wrong with reviews and double checking. I don't think there's anything wrong with that at all. Ben,
But the TGA
you should
won't
never
do it.
trust.
sorry. Go on, Ben.
Yeah, if I can interject, you should never trust the government when they say they're coming to help you. You know, the heart disease is the #1 killer in Australia and around Western countries in the world. So logically, according to COVID logic, we should be sending the police to enforce people from eating Big Macs. Yet there's no laws, and that should have occurred during COVID. We should be stopping people going into, and controlling their diets using force. Yet for a virus which had the same lethality as the flu, we used incredible force, locked down. I do not believe this is about public health. I don't believe it's the result. You must look at the intent of the program by the actual outcomes and what it incentivizes. I've noticed that the outcome of the whole COVID was that there was an encroachment into the liberties of Western Australians and all Australians, and that the government powers enlarged and the liberties and freedoms of the citizens reduced. I think that was the intent. I think the lie begins with health. I don't think this has anything to do with health, disease, or vaccines. I think it's about the freedoms of individuals and about government power. That's where the lies begin.
So are you saying they took advantage of a situation?
I think it was, I think they did. I think it was by design. They, just looking at the media narrative during that time, that you couldn't watch the television or the radio. There was such intense messaging about COVID during that time.
That's true.
It was beyond the scope of propaganda. They were shaping the public narrative, and they were using very coercive tactics because all of us, as humans, all of us are influenced by repeat messaging. That's why the advertisements around the side of a sports ground will work. That's why advertisers pay the money to put those ads there, because they do work. And I observed coercion during COVID. It was so dishonest to see in the government and the media willfully maintaining a level of fear and invoking that human fear response during COVID, invoking compliance, because humans, when afraid, will group together and will, look for authority figures to listen to and become very obedient. So it's
the one thing I would say to that is that, as someone who's worked in the media, everyone always thinks we're told what to say, and we're not until COVID. But we were all pretty much told we had to support the narrative of getting jabbed and everything like that. But I don't know if I'm naive, because my belief then and now is that I said it before. It was like everyone thought this was their World War II. We all had to band together, and I don't know if it was a conspiracy or whatever, but I felt like everyone thought they were trying to do their part. Do you think that's a fair statement, or do you disagree?
No, I agree with that. The road to hell is paved with good intentions. The actions of some of the worst tyrants in human history were likely well intended. They were, to protect a certain group or a certain cause. It's the outcomes and they were using, history always has a tendency to repeat itself. And I observed the tactics and the methods they were using at the time to echo very awful parts of our human history. And it was very, very concerning, such that I was willing to risk and ultimately throw away my career and risk bankruptcy and do everything I could through litigation to stop it. You can't get out of tyranny with compliance. You cannot.
Yeah, well, that's interesting. And look, I even at the time, I admired people who stood up and followed what they believed in. So congratulations to you and to John on that. Ben, I've today been having a look at the report into your case when you were pulled up by WA Police. Now, I was going through that. You had an excellent record regarding conduct. I've gone right through the report. The only thing you ever seem to have done wrong is not take the vaccine. How devastating has this whole thing been to you, losing your job over what should be a right, what you put into your body?
Well, I was parting ways with an agency that was going in a direction that I wasn't willing to follow them in. So I do miss the job that I joined. I was in the WA Police for 15 years. However, I do not miss the job that I left. When there were about, towards the end of my litigation, there were about 30 police officers that were dismissed for not getting, the COVID jab. However, of a police force of 7,000, about 2,000 resigned over a 2-year period between 2020 and 2023. So that's 1/5 of the agency up and left. So I would suggest there are issues in the WA Police which are, the COVID mandates and the way the executive.
How does that compare to in the years before COVID? Was it a much lower churn rate of police leaving the force?
Yeah, well, normally about each year, you'd have about 100 police would either resign.
So it went from 100 to, sorry, was it 7,000 you said? 2,000.
2,000 resigned in a period of 2 years. So it went from about 100 to 1,000 for that period of 2 years. 1/5 of the agency decided they no longer wanted to work there. And I would argue that the ones who left perhaps were the ones the community might have wished to stay.
Would you go back?
No, I don't think I would. I don't think I'd be manageable to go back into the system and to participate in the system that they are running at the moment. I've only the highest respect for the police that remain and are doing good work on the ground, but they are operating in a culture of compliance over common sense, and it's not a line of work that I can participate in. I would enjoy going back just to be a nuisance, but that's about it.
John, where are we now? A lot of people lost their jobs during COVID. It's hard to believe that people did lose their jobs for not taking the jab. When we think back on it, where does this leave people like you? How do you get on with life? How do they find other work? Can they ever go back?
Well, it's not just a case of those that were sacked, Rob. I mean, I'll give you the example of a young girl that is doing a nursing degree. Now, I think she's had up to 7 hepatitis B boosters because they don't register in her blood as being there as a profile. And so it's a requirement of the university in New South Wales and New South Wales Health that you must show antibodies to be able to work as a nurse in the New South Wales Health system. So she can't do her prac. So she's at university. She's had all these boosters for this hepatitis B, but nothing shows up. And so she's getting sick from these boosters. But the crazy part is she's working in a New South Wales Health hospital at the moment as a carer, and that's acceptable. I mean, so the double standards here are just outrageous. I mean, what they should do is drop all of this vaccine nonsense for everyone. I mean, because at the end of the day, if you want to work and you want to take the risk of getting hepatitis or you want to take the risk of getting whatever, then you take that risk. You sign a disclaimer. And
explain it to me, because you're a medical guy. I'm not. So my understanding is the reason they want people to take these vaccines is because if you don't, you become you're more at risk of getting any of these diseases, whether it's COVID or whatever, and then passing it on to other people. Have I understood that right? And is that correct?
Yeah, I think that's partially right. So in the case of COVID, I mean, the Chief Health Officer in New South Wales was of the view, in my understanding, that she wanted everyone to be COVID vaccinated because you were more likely to be less symptomatic of COVID, and therefore you wouldn't be passing on the symptoms to someone else. So like if you weren't sweating, you weren't coughing, you didn't have the COVID disease, you wouldn't be as likely to transmit it. And I mean,
so
you know,
explain this to me, mate, because you sent me Kerry Chan's affidavit and
Yes.
pointed me to paragraph 27, which says, vaccination of health workers is a major factor in reducing the risk of infection and transmission to patients and other staff, thereby reducing the risk of outbreaks in healthcare settings and during provision of healthcare. The COVID-19 vaccines are effective in protecting against infection and transmission and are highly effective in preventing severe illness should infection occur, notwithstanding the effectiveness is not 100%. Now, why did you want to highlight that?
Because that was what was used to essentially provide the medical advice to sack everyone. So she, as the Chief Health Officer, wasn't prepared to accept the risk that I would go to work unvaccinated and potentially transmit the virus to somebody else. And that was the same with the police. That was the advice that was given to the Commissioner of the Police from Dr. Kerry Chant. And so that's why all these people found themselves in the position where they were terminated. And so the reality was that was not true. Transmission was never in play. So it never stopped transmission. So it was nonsense.
Well, I will say, I expected the COVID vaccine to do a lot more than it did. I thought we wouldn't get it if we took the vaccine.
Well, look, the crazy part about this, Rob, is if you were so worried about it, why did you allow people to work on the front line with a medical exemption? I mean, it's either a risk or it's not. I mean, so you can't say to somebody, well, we're going to give you a medical exemption because you've got a heart problem, but you can continue working in the pandemic. But John Larter, just because he says he doesn't want it, he's worried about the side effects from it, we're not going to give him an exemption, so he's out of a job. So just on that rationale, it's mad. But I mean, if you want to look at it from a more practical point of view, I had worked in operation centres, in control centres. I'd worked in air ambulance in control centres where I was essentially just one-on-one at a desk. There was numerous opportunities for people to look at monitors and look at people via webcams and cameras that were symptomatic, that were being monitored at home. So there was plenty of opportunity to deploy staff elsewhere and wait this out. And if you were that concerned about it, I mean, you would think at the end of the day, Rob, I mean, here you are, you're saying it's a pandemic, you know, it's action stations, crikey, it's like World War II, but we're going to sack all the paramedics and the police. Mm. I mean, it makes no sense. I mean, wouldn't you want them on the front line? We're in a war, aren't we? We're in a war. I mean, yeah. Hello. So, you know,
sold me on that one. I'll give you that. Ben, before I let you guys go, you've taken a stand. It's cost you your job. What toll did it have on not just you, but your families? What is the price everyone has paid?
It was an adventure in many ways, because I didn't, prior to standing up in the manner that I did, there was nothing about me that was particularly remarkable. You know, I was just a uniformed cop. It was to go on a journey where you risk, you know, you're thrown into the public stage, and you're risking bankruptcy if, you know, through appointment of costs and things like that. Mm. It was, you know, it fractured the marriage, my marriage that is unlikely to repair. But out of that turmoil, I've become a much stronger person, and so I'm turning it for good. Like, it wasn't fatal. You can actually challenge the court in challenge the government in court and survive. And if you do it carefully, you will come out the other end of it a far more dangerous person to bad actors in the future. So it's been a net positive for me. I would do it again. I highly recommend suing your state government and Commissioner of Police in Supreme Court. I recommend it.
Well, it's a good note to end on. Look, I'm really sorry about what happened with your marriage, but I appreciate you sharing your story. John, thank you for joining us as well. Ben and John, thank you. Your insights have been invaluable. Appreciate you joining us on McKnight Tonight.
No problem, mate.
Thank you.
And can I just say before we go, Rob, anyone out there that wants some production services, I can't recommend this guy highly enough. He's absolutely professional, and the behind-the-scenes stuff with his wife Amanda is absolutely magnificent. So if you need something done, get in contact with him.
Well, videopodcast.online. Thank you, John. I appreciate it. Thank you, guys.
I think the challenge was...
Turn your podcast into a TV show.
Oh, I love this.
For just $80 per hour, you can have your host anywhere in the world.
The mandates are off in America here.
With graphics tailored to your show.
Can I just dispense with all of the emotional kind of foreplay and just jump in? Do you mind?
Video Podcast Services is run by media professionals who know how to make your content stand out from the crowd. Go to videopodcast.online.